I'm Dr. Thomas Kisk, and I'd like to introduce you to Precision Health Solutions. I've been a practicing natural healthcare physician now for over 30 years. I practice as a chiropractic physician with a specialty in nutrition and a specialty in clinical nutrition. Over those years, I've seen some amazing cases, some amazing people. I've had the privilege of working with over 4,000 patients, and I've seen the body's ability to really heal itself. I've also watched 30 years of some alarming health facts, and I've seen the health in America really decline. I've watched obesity go from 13% to 42%. I've seen our sugar consumption increase to 152 pounds per year per person. And keep in mind, this is during our We're Going to Solve Heart Disease chapter of medicine. I've also seen a lot of premature deaths happen as a result of adverse drug reactions, and I've seen a lot of patients be diagnosed with late stage cancers, heart disease, when sometimes it's too late, but really the missing of early disease processes. So for these problems, I've designed Precision Health Solutions. Precision Health Solutions is a proactive preventive health maintenance program designed to attain, then maintain and monitor your health throughout the course of the year. By doing this, what we do is we grab all your biometric data. That includes your blood pressure, your pulse, your temperature, your oxygen saturation, and your body fat percent, your visceral body fat percent. We combine that with a complete blood analysis, and then we do a DNA analysis of over 3,000 DNA SNPs. And we integrate all this information into a data-driven approach, which allows us to make all of our dietary, all of our nutritional, all of our medical decisions based off a huge amount of personal data that we get from each patient. I've prepared a short slideshow for you that I'd like to review with you. It'll review a few things. It'll review a little bit about my career. It'll review a little bit about the healthcare space, and then I want to really introduce you to Precision Health Solutions. So a little bit about myself. I'm a primary healthcare physician that practices natural healthcare. I'm a chiropractic physician with a specialty in nutrition, and I'm a certified clinical nutritionist. I'm the founder of advanced nutritional software programs. I'm a nutritional specialist in multiple spaces. I'm an educator. I teach other doctors how to utilize clinical nutrition, and I'm an author where I've been published multiple times in our national journals. This slide here demonstrates the healthcare space in the state of Florida. There's 4 primary healthcare physicians in the state of Florida. There's medical physicians and osteopath physicians in the medical healthcare space. And in the natural healthcare space, there's chiropractic physicians and acupuncture physicians. We are primary healthcare physicians trained in natural healthcare. Unfortunately, only 10% of the general public utilizes a natural healthcare provider. So the patient, which is depicted by the circle up top, has to figure out all their dietary, nutritional, and preventive health strategies on their own. The purpose of the last slide was to indicate that the whole healthcare space is occupied by natural healthcare physicians as well as medical physicians. We're all primary healthcare physicians. Now I'm going to examine the medical side of the healthcare space, and then I'll examine the natural healthcare side of the medical space. When we examine the medical side of the healthcare space, we realize that there's a lot of death that occurs in that area, and it's a real problem in healthcare. The 3rd leading cause of death in the United States is medical doctor procedures, or what we classify as non-intentional deaths, and that's 263,000 of those that happen each year. In addition, we have about 106,000 adverse drug reactions, and keep in mind, according to the CDC, nobody dies in natural healthcare offices. When we go back to our healthcare space pyramid, really what I want people to realize here is that we really need to change their perspective. The patient's up here trying to figure out how to stay healthy. We're trained in natural healthcare. This is how you stay healthy. We'll tell you when you need to cross into the more dangerous medical healthcare. Although we will also monitor your health properly, but everybody needs a natural healthcare physician in their healthcare strategy program. Now we're going to look at medicine and really what we do in medicine. And my point here is that we do an incomplete analysis and monitoring of patients' health. That's why we have a lot of our health problems. We do about 70% of the blood work that's necessary to ensure against early disease detection. We don't consider body fat percent to be important or visceral body fat percent to be important, and we don't measure our oxygen saturation. We don't give any advice in the foods that we provide. We don't blood type, and it's real important, especially in precision health solutions, that we eat right for our blood type and we identify our food sensitivities, because you'll feel hugely, just a whole lot better when you're eating the right foods. We also don't utilize DNA testing in medicine like we should be using. We can use that for dietary recommendations, nutritional recommendations, and most importantly for drug safety recommendations. And we sure don't prescribe nutrition programs. So as I go back to the top here, we're doing incomplete blood work. We're not educating the patients in diet. We're not taking body fat percent. We're not doing oxygen saturation. We're not doing any DNA testing. And we're basically telling people they're healthy with this assumption. And I think that we're assuming a lot here, and with our greatest asset, we should not be assuming a lot. Now that we've examined the medical side of the healthcare space, I'd like to examine the natural healthcare space. And I think we'll demonstrate to you that the natural healthcare providers, again, primary healthcare physicians, are more qualified to provide you health maintenance programs than the medical physicians. Now I'd like to examine the natural healthcare side of the healthcare space and introduce you to Precision Health Solutions. Precision Health Solutions is designed to attain, maintain, and monitor your health. We measure all your biometrics, your blood chemistry, and we do a DNA analysis to identify all your metabolic blueprints. We identify your food sensitivities, and we identify your blood type so that we can adjust your diet to eat right for your blood type. We take our blood chemistry analysis and we provide a nutrition program for that to maintain a normal balance within the blood chemistry. And on top of that, we analyze your DNA blueprint to help us kind of strategize our preventive health strategies with our DNA, with our blood chemistry, and with our biometrics in mind. So this is how we maintain your health, through your blood, through your DNA, through your biometrics. We identify your food sensitivities, we identify your blood typing, and we maintain this. We check you at the beginning of the year and we check you at the end of the year. And now I'd like to introduce to you the 7 product lines and the great physicians that are involved with these product lines to provide us precision health solutions. After 30 years, this is what I put together, and this is really your medical advisory board. We utilize the Institute of Functional Medicine for our food elimination procedures. Dr. Jeffrey Bland, just a genius of a man. I've been working with this group for over 30 years. We use science-based nutrition to analyze all our blood analysis and help us with our nutritional recommendations and to identify any early disease processes. And we run all the science-based nutrition through LabCorp. We use Thorne Research products and designs for health products to help us with our health maintenance. I've worked with Thorne for over 30 years, and they're officially partnered with Mayo Clinic on all their research studies. Over here with Designs for Health, this is Dr. David Brady is the Chief Medical Officer. He is part of our Medical Advisory Board. Him and his team of clinicians are always available to us, as they are at Thorne. Thorne has Dr. Kathleen Head, Dr. Alan Miller, and these are all people who are part of our Medical Advisory Board. So we can look at this as this is just me identifying some great products and some great doctors over 30 years of practice, and now I'm bringing them all in together to help me facilitate the application really of all their products, all their product lines, and all their knowledge. These are some incredible physicians that we're working with. Diagnostic Solution Labs is also under the direction of Dr. David Brady. They do all our labs that are more our specialty lab, like our stool samples, our microbiome testing, and just more of our specialty lab stuff. The center of the program is really Dr. Peter D'Adamo. We eat right for our blood type because that is just science-based. We got to eat the foods that work right for our body. A lot of foods cause antibody-antigen reactions in the body and form agglutination products. So that's Dr. Peter D'Adamo's book 25 years ago, absolute, way ahead of his time. Peter D'Adamo also wrote all the bioinformatics that are utilized for our genomic insights. We take 3,000 of your DNA SNPs, we look at them individually, we do a meta-analysis on how they all work together, then we put that into a meta-analysis of over 900,000 DNA SNPs to provide our DNA blueprints, our genetic blueprints, if you will, to help us make all our dietary, nutritional, and medical decisions. So just an incredible product. This product is also on a artificial intelligence platform that is constantly updated on all the PubMed research out there and all the genetic and genomic research indexes that are out there. So it is always up to date. So thanks for taking all your time to review this presentation, and I think we've identified some of the problems we have in our healthcare system. I think I've identified a great solution for that. So if you want to stop assuming you're healthy, be proactive about your health, and enroll in a great product line that involves attaining, maintaining, and monitoring your health through blood analysis, your body biometrics, and your DNA blueprint, then enroll in Precision Health Solutions. I'm Dr. Thomas Kiska.